Well, Dr. Gerry, thank you for being our first guest on our mobile podcast experience. We are so excited to have you.
I'm delighted to be here. I am delighted.
Well, we share that sentiment. I guess to start off with, we're going to ask our icebreaker question that we're going to ask of every host. What is the best concert you've ever been to?
The best concert I've ever been to, it was not Taylor Swift, because I've never seen a concert with Taylor Swift. I would have to say Bruce Springsteen.
It's a good one.
Springsteen and the E Street Band are capable of taking people on a cosmic ride where you forget everything except what is happening. It's pretty magical, actually.
That's amazing. Where did you see him?
In Atlanta.
Oh, very cool.
Yeah.
Awesome. Well, to get into the dentistry aspect of this podcast, what is something that you think is important for practices to consider as they're building out the culture of their practice? Like the things that they really want to pay attention to that are important for really building a culture that's unique to them and something that is a place that they want to go every day.
Well, in pediatric dentistry is a fairly magical experience. I think pediatric dentists do something that no one else actually does in the same way. You take a child who's fearful and parents who are afraid, because frequently this child is 2 or 3 years of age, first visit to the dentist, and the pediatric dentist is trained to have the capability to make this actually a pleasant experience, even an enjoyable experience. Pediatric dentists will have experiences where this child is so afraid, and then when they leave, they're high-fiving the dentist and the team members. Mm-hmm. That's a magical thing to be able to do. But the referral that I'm making should not just be the pediatric dentist. It's the entire team. It's the culture of the office. It should always be a pleasure to come to the office, even though it's a stressful experience, which means that everybody on the team needs to be functioning in the common good, not in their own good. Well, their own good is the common good. Mm-hmm. So personal issues need to dissolve into what is best for everyone during the workday. And I think that's what makes a specific team, a specific practice exceptional, that everybody is doing that. Now, of course, I find it amusing when I hear things like, well, look out, the doctor's not in a very good mood today. And that's what the doctor brings to the office? Mm. They're not in a good mood today? Mm-hmm. What are they expecting from the team? So I think it's important to find team members that all feel the same way, but they have to continue to feel the same way. This question is it a good day at the office? Well, it's up to you to make it a good day at the office, and that's what makes things exceptional, because it's not always a good day. Mm-hmm. I think that's one of the most critical things, is to hire people and keep them. Well, in order to keep them, not only does it have to be pleasant, but they deserve to be paid appropriately and rewarded appropriately. Mm-hmm. Does that help?
Absolutely, yeah. We were just talking about, the idea of adding value, and how do you add value to somebody, whether that's your staff, whether that's the child, the parent coming in, and that always being a plus in someone's lives. So that's, I think, exactly what you said of, how do you shape that, and how do you bring that energy, even when it may not be a good day, how do you make it one?
Yeah. Well, the term value is an interesting term. If you look it up, it means it's important, and that it's worthwhile, and it holds its worth, like a valuable coin, or a valuable experience, right? It's the reason you take photographs, is to remember the experience. Mm-hmm. So if the entire team is not on board with this idea of making the experience valuable, that's not going to be a successful business. It's also not going to be a very happy one.
Mm. Yeah. So what for, I guess, kind of looking at the industry as a whole, and really, you're so involved in pediatrics, and you lecture and you go to offices and you consult practices. What would you say for the future, really, of the industry of pediatric dentistry is something that should be paid attention to? What do we need to have our focus on as we look at how this industry is going to shape out?
Well, it's still the golden age of pediatric dentistry. At one time, it was the golden age of orthodontics, but now orthodontics, despite what some claim, I see it's flooded with orthodontists and more coming out all the time. Pediatric dentistry, however, it's still the golden age. Now there are more and more dentists being trained, dentists specifically, and more dental schools opening. That means it's saturating the market. When that happens, these people that have sometimes incredible debt, well, they're going to do what needs to be done to service that debt. And I would hope that pediatric dentists make it a priority that regardless of paying off your debts, that you don't turn into the person where money is the main thing in your scorecard. Money is the reward. It is not the objective. Everybody deserves to be paid for what they can do. Everyone. Well, but if that's the key objective, if that's the scorecard, is how much money are you making? And if you don't keep making more, that you consider yourself a failure, I think that's very destructive for pediatric dentistry.
And it sounds like it would be hard to stay fulfilled like that if that's the end goal, that, that if there's not kind of other goals that you've got of, within your practice or even within kind of your career, then you might get burned out very quickly.
I'm very biased because, as you know, I'm dual trained in pediatric dentistry and orthodontics, but I have what I consider the heart and soul of a pediatric dentist. So the idea that money is the scorecard, it's hard. I know there are pediatric dentists that feel that way, that is their scorecard with their fast boats and fast cars and fast vacation homes and fast girlfriends and fast kids. I know that that's their scorecard, but I really hope that that's a huge minority in pediatric dentistry. The rest of dentistry, since Fireside focuses specifically on the pediatric dental community, I would hope, I would demand, that's a little strong, that I still think that that's where pediatric dentists are at, having 7 university appointments, the majority of where I'm speaking with pediatric dental residents. I still think I don't see many exceptions to it. And when I talk to the department chairs and directors that are there and faculty members that are there more often than I am, I don't really hear much about, well, who's your best resident and who's really not so good. I really don't hear about anyone who has the wrong heart, the wrong soul. I don't hear that, which I'm quite happy about.
That's amazing. And I think that's one of the reasons we are so happy to focus on pediatric dentists, is that they, from our experience, what the ones that we have met, I mean, everyone has shared that heart and that soul. So it's a cool industry to be in for sure, and one that we hope to bring a lot of value to.
Well, can you imagine being in a medical specialty where you're right up in the kid's face? The parent these days is typically right there. If they're not right in the operatory, they might be looming over the kid, like Dracula. Can you imagine having that experience and the kid is upset, the parent's freaking out, and the team, it's not just the pediatric dentist, the team has the capability to calm that down. As I said in the beginning, it's a magical thing to be able to do. As far as sedation, yeah, there are children that need to be sedated. They just can't cope. I think frequently the parents probably need to be sedated as well, if not held under the water for a few minutes. I mean that in the kindest possible way. But in these situations, can you imagine being in a medical specialty where you actually have a good time, or pretend to sometimes? Sometimes you're really not having a good time, but you need to reach down and bring it up.
Yeah, it's that ability, like you said, to find the thing that's going to make it a good day, or find, even if you are, as I think I've heard you say before, fake it till you make it. even if you're having to do that, how do you do that in a way that you're still creating the experience that at the end of the day, that parent, that child would have no idea that, that it might have been a more challenging day, or the patient before, the one that you're seeing was one of these challenging cases. I mean, it's all about, I think, that energy that you can bring to it, and really, finding that on a very consistent basis.
I think when you're not feeling well or something is looming over you, some emotional issue, a family issue, something like that, I think letting somebody see that in the office, letting them know that you're dealing with something difficult, I actually think there's no place for that. Mm-hmm. I think it's unfair. I think it's weak. I actually think it's cowardly to bring that into the office. Now, at least I know one of my highly respected colleagues feels differently about that this person feels that you should let the team know that there are issues in your life right now, and that in their culture, it's very helpful for everyone to know there is something happening with somebody on the team. Mm-hmm. And the idea is that it engenders more compassion.
Right.
I think that's one approach.
Yeah.
My approach is probably a little bit different.
Well, I think it goes back to the idea of, is it additive to the experience? Is it something that is helpful in, setting the tone, or is it something that then becomes a detractor? So it could be all about the approach, and just, if I'm sharing this, hey guys, got into a wreck on the way here, really tough, something else happened. I mean, if you're sharing it in a way that maybe does engender that, a little bit of vulnerability, but at the same time, compassion, and hey, we're in an environment where, we understand life happens, but you've got to show up and be 110% even when life happens. I could see it going both ways.
Now, you have a good point, and I think the difference is generational, because I'm of a completely different generation than the parents who bring their kids to the pediatric dentist now. I mean, I'm old enough to be their grandparent or their great-grandparent. I mean, my generation, the way I was raised was toughen it up, kid. Mm-hmm. Toughen it up. Mm-hmm. And it's just a completely different game right now.
Right.
And you either know the rules and play to win, or you shouldn't play the game. Mm-hmm. So if the culture of the pediatric dental practice is such that what we do here is we want everyone to know that there's a stressful situation in your life. Maybe you don't need to say what it is, but at least tell everybody. Mm-hmm. And it's helpful in that culture, in that practice. Mm-hmm. I think that's an interesting thing you bring up, because it is a generational difference.
Yeah, and maybe it could be a good topic for conversation in the community. How do you guys how does each practice handle this? I think that's something we're hoping to build is, every practice does things a little bit differently, and every practice is unique, but there are so many ways that we can learn from each other. And, what one practice may do might be different than what I do in my practice, but if I can learn and adapt and test things out, it's all about that kind of environment of sharing and collaboration and continuous improvement.
Pediatric dentistry has changed remarkably, because it used to be male dominated, and that is almost an understatement. And now, well over half. I mean, for example, at the University of Alabama at Birmingham, where I'm on the faculty, there was one year where it was all women. There were no men residents. And I said to the department chair, highly respected individual, Dr. Noel Childers, I said, all women? And he said, well, we're on the match. That was selected by the computer. These were the people that matched up. I thought that was incredibly interesting. So now you have the female touch. Mm-hmm. Well, my wife has, practiced general dentistry for about 25 years or something, but she was one of the first women dentists in Atlanta, one of the very first. And her maiden name began with a B, which meant, in fact, there was something called a phone book. Allison was.
I do remember the phone book, yes.
She was right early in the phone book under general dentistry. Mm-hmm. Well, she would see patients, not unusually on an emergency, that had never seen a woman dentist.
Wow.
Well, dentistry was male dominated. Mm-hmm. Like in my dental school class, of over 100, there was one woman. One out of 100. Well, they would see my wife as their on an emergency and immediately wanted to switch to her because the feeling was that she was more gentle, more compassionate. She probably was than I would have ever been. I'd be thinking, toughen it up. What are you, a baby?
You need some more Novocaine? No.
Turn up the nitrous. All right, turn it up. Well, Allison, I've enjoyed speaking with you. I always
Absolutely.
do. And I'm really delighted to be part of the Fireside community. I think it's an exceptionally worthwhile adventure.
Well, thank you so much. Thank you for the time today. Thank you for welcoming us to your another one of your great CE courses today and our mobile podcast. But we are just so appreciative of you.
Delighted. Thank you.
Thanks.